Stoke-on-Trent has a proud industrial history, but today it's one of the most deprived areas in the country. Sickness and disability is a major factor, preventing many people from working. It's a challenge.
We have people who are dying earlier of cancer-related illnesses, people who are dying much earlier from cardiovascular related illnesses, stroke, and a big problem for us in Stoke is respiratory illness. From the industrial legacy we've inherited a lot of lung disease, and a number of our patients are dying much earlier than other people across the country.
Good morning, Stoke-on-Trent Clinical Commissioning Group. How can I help you?
In an attempt to combat the problem, Stoke-on-Trent Clinical Commissioning Group is giving more power to clinicians so they can help to create services that reach right into the heart of the community. Yotun Tanvir has two sons, Hasib and Hassan. Hasib has breathing difficulties and has previously ended up in hospital.
I had to deal with it on my own, with my husband having to look after the other one. And it just was really stressful because he wouldn't keep still as well, with him not being at home. He wasn't really comfortable there either.
Now before we give it, we obviously must make sure we shake the inhaler, okay?
But a new hospital-at-home service meant the next time Hasib had an attack, Yotun's GP was able to arrange for a specialist nurse to go to their home.
We came to Mum and we observed Hasib for a couple of episodes. We assisted Mum giving the medication to help Hasib get slightly better. We sort of taught Mum as well in giving the medication. We give Mum a plan so she could manage over the evening and into the morning. Then we returned for a second and third visit until Hasib was actually recovering.
It was more comfortable because it's all in your own home, and he was relaxed as he was as well, and I was more relaxed.
An audit of the hospital-to-home service has seen some remarkable results.
The families who were part of the audit reported that 88% thought the service was excellent, and also of the children who had been seen by the service, 89% didn't require hospital admission.
Each admission on average costs £800 per day. So if you think about 1,000 admissions, you can see the huge savings, considering that this service cost her very minimum. It's only like 200k, which cost her for the whole year.
Stoke-on-Trent CCG truly believes that clinicians leading commissioning helps give them the freedom to innovate.
The commitment on our part is to reduce bureaucracy so they can get on with things and make things happen to their patients.
What we're delivering now are integrated local care teams. GPs have been asking for this for their patients for a number of years, so now we'll have nurses working closely with general practice, with social workers involved in that team, and our community psychiatric colleagues.
The CCG wants to empower GPs and clinicians so they can help people learn how to cope better with their illnesses, helping to cut hospital admissions.
It's a wonderful job. We actually do. It's a lovely way of nursing. As a paediatric nurse, you can see the impact there, and then you give to the families and the difference that it makes to the parents and the children.
And I think one of the things that general practitioners want is the resources to follow the patient from the hospital out into the community in primary care, because we believe we can do things bigger and better.
Within a short space of time, these changes are already helping to improve lives.